My name is Tracy Stakowski. I work for Lakeland Regional Health System. I'm the Charge Master Specialist. I've been doing that for 20 years. We are a three-system hospital at Lower Southwest Michigan. We've been using VitalWare for 2 years. Our search for a new technology vendor was due to our EHR system of Epic. Once we became on Epic, some of our Charge Master wasn't exportable to us, or we weren't able to see part of our Charge Master, the Willow system, our materials management system. So with bringing on the VitalWare, we were to export those systems and be able to see our full Charge Master. Like I said, with Epic, our technology wasn't available for us to see our full Charge Master. No, we had CraneWare originally for our Charge Master, and when we got upon Epic, we were no longer using CraneWare due to expense and them not being able to export our Charge Master. And VitalWare actually reached out to our CEO, and he saw a demonstration, liked the product, and we watched the demo and decided to go with VitalWare. So we were looking for a new vendor due to the cost of our current vendor and the inability for our current vendor to give us access to our Charge Master due to Epic.
Was there anything about VitalWare's presentation that was different to you and your colleagues maybe were surprised or unaware of before? Tell me about the VitalWare presentation, I guess.
Yeah. So when we saw the VitalWare presentation, we were impressed about the ability to export our Charge Master in easy, readable, usable columns. Also, we were impressed of all the data that would be at our fingertips with the Medicare reimbursement, the South Panel tabs, and the OPPS calculator to help us verify reimbursement, which has been an issue for us at our hospital. The VitalWare products we currently use are the CDM, Vital Knowledge, the libraries, the OPPS calculators. That's all we have right now.
Okay.
We currently use the Vital Knowledge, the OPP calculator, and the Vital CDM. On an average day, I would say we have about 15 people that would interact daily. We have about 40 people on our VitalWare sign-on in different departments. Yep. So our account manager is awesome and very responsive to any questions we have at any time. I get out of the VitalWare user conference the ability to look at the system in different ways, to suggest programmings that would help the users in our daily activities. Yes, I would recommend VitalWare for the Charge Master solution, especially for companies that have Epic so they can see their full Charge Master in a usable, friendly way. I think Epic users for VitalWare, we would suggest you use that for a full view of your Charge Master from all the Epic systems, and it's very transparent for your Charge Master. Okay. I think an Epic using hospital would benefit from using VitalWare in order to see their Charge Master fully in an easable, exportable format, which is hard to get out of all the different Epic systems, and it would give them more clarity to their Charge Master. I think VitalWare is a great system for hospitals and all different type of people in the hospitals, being from radiologists to cardiologists to HIM to finance to patient accounts, that gives them the ability to look at charging in a different viewpoint.
My name is Jed Rudd, and I have been in the healthcare industry for 12 years. I've spent the majority of my time in healthcare leadership and currently serve in a healthcare executive leadership role at Mad River Community Hospital. I'm the Director of Ancillary Services and Safety. Mad River Community Hospital is a 78-bed acute care hospital. We have also our outpatient physician clinics and many other services, healthcare services we do in the community. At Mad River Community Hospital, we've had a lot of increasing challenges. We've had an increase in the backlog of our claims, decreased efficiency with our coding. It's been challenging to move efficiently through our revenue cycle, and we've had to do a lot of going back and editing and re-editing to make sure that the codes are correct before we send them out. So a lot of money gets tied up in our revenue cycle and doesn't ever come back in efficiently to the hospital. Technology has always been changing, but we found that our encoder, which was the predominant encoder in the field, 3M, wasn't necessarily changing or evolving to meet our evolving needs. We had significant cost and significant increase in cost year over year with no visible innovation within the software. And so we knew we had to pursue a different partner to help us innovate within our own system to capture that revenue that we knew was kind of being sucked up or hidden in those pockets of the revenue cycle within our organization. We had partnered with VitalWare on a number of different products, but nothing that had been quite as impactful or risky as Vital 365, because we were going to be saying goodbye to a product and a service that we had been using for the past 13 years. But we also knew that the challenges we were facing were so great that we had to make bold moves. And so VitalWare made it really easy for us to make that bold move. They helped us reduce the risk as we transitioned, and they were highly supportive and available throughout the entire process. Prior to joining Mad River Community Hospital, I worked at a community hospital in Silver City, New Mexico. And we talked often about concurrent coding and how that would be a powerful process to institute. However, it was highly unrealistic and it seemed too costly to implement with our limited resources. And there was not an obvious technology solution to support moving towards concurrent coding. Because ultimately what we wanted to start having the conversations about the patient's coding prior to the patient leaving the building. That way we could more actively and accurately capture what's being done. At Mad River Community Hospital, when we started to explore our relationship with VitalWare and Vital 365, it became apparent that the technology had come about that would allow us to do concurrent coding through technology and without increasing our resources. So the same coders that were coding in 3M prior could now be actively concurrent coding and encoding at the same time. And it's really revolutionized and streamlined our coding process. Vital 365 has made a huge difference in our revenue cycle efficiency. We've found a 28% reduction in our DNFB and DNFC days. We saw a 30% improvement in our revenue cycle employee efficiency. We saw a 13% increase in cash, and we saw a 50% reduction in our total software cost supporting that process. I would absolutely tell my colleagues to look at VitalWare. Their suite of products is innovative, it's evolving, it's addressing an area, a black box, if you will, in the healthcare revenue cycle. The mid-revenue cycle process doesn't have a lot of solutions built or tailored for it, and VitalWare is cracking that open and bringing transparency to a very important phase of the revenue cycle. With VitalWare's suite of products, you can start to move forward to more efficiently capture revenue and get it out the door cleaner and quicker than you ever did before. And the company is really cool too. They're a very supportive organization, they're innovative, and at Mad River Community Hospital, we have that independent spirit, and VitalWare reflects that spirit of innovation, independence, thinking outside the box, and partnering as team members and collaborators. And they've absolutely been our collaborator through this process and supporting us each step of the way. And highly adaptive. Whenever we have suggestions for improvement or ideas, they're open to the feedback. You cannot get that kind of feedback from a bigger entity out there. They don't talk to you like VitalWare talks to you. So we're really happy with that relationship. VitalWare has given us, as a small community hospital, the ability to concurrently code with no additional increase in staff. We are actively speaking right now, day to day, with our physicians about their documentation and what's working and not working while the patient is in the hospital. This is a radical change in how we manage our revenue cycle and our coding processes. It builds the conversation into the clinical process as opposed to an afterthought or a note the physician receives 6 months after the patient left. Suddenly we're talking about the patient as they're on the floor, and we're talking about what's been captured. It's hard to overemphasize how important this changes everything in healthcare when we can start to have conversations with our providers about their documentation while the patient is in the room. Vital 365 unlocks that conversation, makes it transparent, and helps us move towards cleaner claims right when the patient's in the bed. VitalWare is innovative, supportive, a family environment, team-oriented, collaborative. VitalWare is creative.
We have 11 hospitals. One of them is an academic teaching hospital with a lot of research, and several smaller community hospitals in a variety of places in the state of Minnesota. Most of them centered around the Minneapolis area, but some in northern Minnesota as well. The VitalWare products that we use are the Vital Knowledge and Vital CDM. One thing that we've found unique about VitalWare is the breadth of information that's available out there without a lot of multiple clicks into different areas to find it. We've had a lot of feedback from our users that they really like the workflow product, and there's been a lot of improvements over what we were previously had with our other vendor. One of the biggest things that VitalWare helps us with is an information center for a variety of people to access. Because we're a multi-hospital system with hundreds of departments, we have users of VitalWare in all kinds of areas. Instead of having to come directly to the CDM team for information, they can go into the product and access all kinds of different things that they use. VitalWare has helped a lot because we are an Epic user. My team has a unique ability to go in and actually make all of the changes in Epic rather than running them through IT. So we have to have access to multiple fields of information, and we've been able to pull in everything from the EAP into our VitalWare product so that everything is visible that my team updates. There's probably 42 to 50 different fields that we utilize and make updates to, so it's been very helpful to have all of that information pulled in. We also have responsibility for maintaining some of the source system information like Radiant and some stuff in Willow, and we've been able to pull in the Radiant charge codes, the Willow ERX file, the OpTime supply file for supplies used in the operating room, and all of that has expanded our ability to see everything rather than go to another person and ask questions. We can pull it right up within VitalWare. One of the things I wanted to talk a little bit about was the improvement that we've seen in the workflow. Our previous product that we were using didn't allow multiple line items to be requested and to process them each individually, or to reject one and return it to the user and then continue to process the rest of them. The users have liked it a lot better. They can add something to a workflow request that they've previously submitted, which has been a big advantage. And we're able to filter and see only the things that we need to see. We have multiple CDM analysts that process those VitalWare requests, and they don't want to see everything. They only want to see those that pertain to them, so that's been helpful as well. I would recommend VitalWare to any type of hospital system. Large integrated systems, we've seen the benefit of the fact that it can pull so much information in. I think smaller hospitals definitely benefit from it because I think they don't have as many resources available to them, and certainly it would be helpful for them as well. Robust. We've found VitalWare support to be very, very good. There's never been any delays anytime that we've reached out to them. They're very knowledgeable, they know the product very well, and they're here to help. If somebody's not available, they bump it up to somebody else to get back to us, so we've had very good response.
Hi, my name is Andrea Modlin. I am from Gunderson Health Systems in La Crosse, Wisconsin. We are a 325-bed Level 2 trauma hospital. I've been in the healthcare business for 12 years, working in medical coding, billing, denials management, and currently I am in CDM department as a charge master data specialist. My favorite thing about VitalWare is that they integrate easily with Epic because we are an Epic hospital. So we can take export files from Epic and import them into VitalWare and make changes on them, and then we can export them back or import them back into Epic easily. My favorite thing about VitalWare is the relationship we have with their staff. They take all of our suggestions and implement them or tell us why they can't be implemented, or they try different ways to do things for us. I love my account manager. I feel that I can email her anytime and she gets right back to me with the information I'm asking for or where I can find the information if I'm just having problems finding something. Or if I just want to make a suggestion on something and she may know how to do it better. I would recommend VitalWare to anyone. They are very responsive when making suggestions on changes, and if something doesn't work correctly, they get back to you right away on if they can make a change to that or not. Friendly staff. I would recommend VitalWare to any hospital because they are user-friendly, efficient, and effective. We have found VitalWare to be innovative, accurate, and up-to-date.